All right, thank you for staying with us right here on Good Morning Kenya. We get straight into matters health, and today's conversation is on breast reconstruction and aesthetics. And joining me for this topic, to discuss this topic is one Dr. Andrew Were Onyino, and Dr. Andrew is a board-certified plastic reconstructive and aesthetic surgeon at the Kenyatta University Teaching, Referral and Research Hospital. Welcome to the program.
Thank you for having me.
It's a pleasure to have you on the show to talk about this matter that I feel like most times is not really talked about, you know. So let's begin with the definition. When we talk about reconstruction, what exactly are we talking about, and what's the difference between the reconstruction and the aesthetics part?
So plastic surgery basically is classified as reconstructive or aesthetic bit, and breast reconstruction mainly focuses on returning the tissue. For example, maybe you've had breast cancer and then you had a mastectomy done. So your main aim is, as a plastic surgeon, is then after removing that breast tissue, is to give the woman or the man back the mound, the breast bone they had. So that's basically breast reconstruction, and it's normally done for patients who maybe had a breast cancer or had maybe large breast, where what we call gigantomastia, that we also do the reconstruction, or genetically you were born with the small breast, what we call micromastia or tuberous breast. So we're able to go in and use part of your body tissue from another, maybe with back or the tummy, and then reconstruct for your breast. We can also do it with silicone implants to give you that breast mount, or use fat transfer to do that. So that's basically what breast reconstruction is.
What's the difference between now the reconstruction and the aesthetics?
So for aesthetic bits is normally where a man, or let me start for a man because most of them are normally forgotten. Maybe they have breasts, what you call gynecomastia. Then,
a man can get gigantomastia?
No, gynecomastia. So so what we call it male boobs. This happens when you use steroids, or maybe you have a genetic abnormality when you're born, and then we're able to remove that breast mound and give you a chest like for a man. But then when you talk about the aesthetic bit, is where you desire maybe to have a bigger breasts, or maybe you desire to have smaller breasts, or maybe your breast after passing through pregnancy, be it droopy or saggy, then you want them to be lifted and become pucky. So then we're able to reconstruct your breasts with the aim of making them look more beautiful. So that's the aesthetic bit.
That's the word aesthetic.
But reconstructive is, it's more after a disease process, and most of the time it's a cancerous breast disease process.
So for the ladies who it's just all about the cosmetic bit, that's the aesthetic part, not the reconstruction.
Not the reconstruction.
All right. So are there different types of reconstruction, you know, of breast reconstruction? Are there different options? So normally when you undergo, let's say, mastectomy, this is where they remove the cancerous breast tissue. Then you normally undergo treatment, and once the cancer has receded, or you've been cleared of the cancerous cells, then we have different options. The first option that we normally prefer is where you use your own body tissues to reconstruct the breast mound. So we can go maybe to your back, on the right side of the arm or the axilla. We can also get tissues from your tummy to construct that breast. Depending on how big you want them to be, then we can also address the other breast that was unaffected by making it the same size with now your reconstructed breast. We actually go further and even do the nipple reconstruction. So once we construct, if you have lost a nipple during that particular process, where we didn't spare a nipple when you're doing the mastectomy, then we're able to reconstruct with your own body tissue. The second type of breast reconstruction is basically where we use silicone breast implants. So what we do is, after you've undergone, you've lost your breast, maybe through that cancerous process, we've done a mastectomy, then we use a silicone item, what is called a breast tissue expander, to create a pocket in your breast, in your chest, where we can be able to put a silicone expander. The other form of breast reconstruction is where maybe you had a lump and they removed that particular lump, but it was big enough
and left you with smaller breast. So what we do then, we can get fat from a different part of your body, or use hyaluronic acid fillers to actually now create for you a breast mount. But that we do through a serial process. We'll need 2 or 3 surgeries to create that.
Yeah. And how do you get to decide on which particular reconstructive surgery suits who? You know, from the tissue one to the silicone one. How do you get to decide, or is it up to the patient to pick?
Not really. So different patients, you will find a patient will come who has a high BMI. Sometimes because of that weight, we cannot safely use, let's say, your abdominal body tissue to construct that breast mount. So for that case, then we'll maybe advise you to use silicone implants, or then ask you whether we can have the tissue removed from your back if they're big enough to create the mound. Some ladies, you find they're maybe too small, so they don't have that extra tissue to actually create the mound. And for them, then you give them an option to actually now increase the space where you can create a breast mount using now the silicone implant. So it's based on the individual patient characteristics and their health status, and then in discussion with the plastic surgeon, then we get what best fits you.
This may seem like a question that, but is there a difference between, you know, the tissue one and the fat? You know, can you use fat, or it's the same one and the same thing?
No.
It's not
so
the same.
there are different things, but you can use. So when you say using a body tissue, fat is also a body tissue, but then we call that lipofilling, which is just basically using liposuction, getting the fat from a different part of your body, and then using it to create the mound in a serial manner, let's say 2 or 3 sessions. But we say a fat, getting a body tissue, then that one you get actually a skin and a bit of fat from a different part of the body, mostly the back and the tummy, and then use it to reconstruct the breast mound.
All right. So how long does the surgery take?
On average, it depends. If you're one surgeon, it can take you between 4 to 6 hours to do the breast reconstruction using the different body tissue, what you call a flap, to around 4 hours if you are 2 surgeons. When you use the silicone implants, it tends to be a bit shorter because it saves you the journey of having to harvest the flap and reconstructing the mount. So then you find that one can take between 2 and 3 hours. Yeah.
There's something you had mentioned about, I would love for us to get into it. That's the nipple reconstruction as well. So you also reconstruct the nipple?
Yes. So plastic surgeons actually here in this country have the ability to, once you have undergone a breast mastectomy, when the cancer maybe involved the breast nipples, then you lose the nipple. To restore that normal form, then you're able to reconstruct nipples for you. Of course, they won't be as functional as what God gave you, but then if someone looks at you as a woman, then you're able to see that your breasts are almost normal. We also use tattoo technology. You can actually use draw 3D nipples for you if you want that option. And basically just to ensure that we restore your womanhood and your dignity and just you being you, your quality of life. So it's for the look. So if say someone has a child or gets a baby, they cannot be able to suckle. They cannot be able, and their options then will be able to recommend for you in terms of how you'll breastfeed that baby. I think one that is normally a false notion is when you have, let's say, a breast reduction following having very heavy big breasts, what we call gigantomastia. You can actually breastfeed after that particular procedure. So it depends on the procedure that is done. If a mastectomy is done, you lost the breast tissue, then breastfeeding might not be an option for you. If, let's say, it was just a large tumor, we had then the gigantomastia, then we can be able to reconstruct the breast in a manner that allows you to actually continue breastfeeding.
Does it affect the feeling of the overall feeling of the breast?
One of the side effects of, especially we go towards gigantomastia or breast reduction, is you might lose your nipple sensation, which comes back between 6 and 9 months. But then we have developed techniques to ensure that we try as much as possible as surgeons to ensure that that does not happen.
what does that recovery period look like, and how much time does it take for one to recover fully from the reconstruction?
Yeah, so recovery, so the reconstruction can range from a daycare, you come in the morning and you leave the hospital, or you can come and stay with us at least 3 days as an inpatient, where we monitor how the new body tissue is taking in the new place as a breast mount, and give you treatment to ensure that there's no infection or other complications. Within 2 weeks, you should be up and about. What might delay is now you integrating back to society, where we give you a schedule and we say, do not, let's say, involves so full recovery to 12 weeks.
Fully recover
into your normal life.
Yeah, and you know, for someone who has undergone, you know, mastectomy, how long should one wait before getting the reconstructive surgery? Is there a time frame for it, or can one, you know, get it, you know, cut and just have it done immediately?
Yes, so we have those options depending on the disease the breast has. So they're what we call immediate reconstruction, where we're able to remove the cancerous breast or the tumor and reconstruct the breast at the same setting. But then there are those where you have to follow protocol. For example, you have to undergo a session of chemotherapy or radiotherapy to ensure there's total clearance. So you find for those, we normally recommend 6 months to 12 months for the breast to settle, for the radiation injury to settle, then you can consider reconstructing the breast.
Now, are there potential risks? I think everything has risks and maybe complications. So if you can just take us through the risks and potential complications that may arise from this, and how you work on, you know, minimizing the complications.
So like any surgery, there's a risk. But then in trained hands, that's when you're in board certified plastic surgeon, where you've been certified by the government to do that particular surgery, then you're able to ensure that you mitigate. For example, I'd mentioned just loss of, let's say, nipple sensation. We have a technique that we do to ensure that that is mitigated, and we stick to it so that you can be able to have sensation in the breast. Normally, sometimes you can move that tissue and it refuses to take. And that's because maybe your blood supply issues, and that's when patient selection comes in. You might find that you come and you feel you have enough body tissue to reconstruct your breast, but then the surgeon will take you and tell you your body mass index is so high. If you do this reconstruction, then it might not take. So either go lose weight first, or then consider another viable option. Of course, infection, that we mitigate by having good drugs, antibiotics, and pain is another thing that we manage very well. Most of the time when you hear plastic surgery cases, people talk about pain. But then in experienced hands, you find that from experience, we're able to control that. At KTRH, we have very experienced anesthesiologists and who can be able to even give you blocks, which ensure that your recovery is as comfortable as possible. So like any surgery, there is also maybe a risk of you having a clot, which mitigate that by giving you anticoagulants. So every risk that is there, we are able to manage it very well at our institution.
How many successful, you know, maybe reconstructive surgeries have you been able to undertake?
At KTRH, if I start at KTRH, last year, this is our second breast cancer reconstruction camp. We did more than 30 patients where we were able to do breast reconstruction, and most of them to successful with less than a 4% complication rate, which we also were able to handle. On a personal level, I've been practicing plastic surgery from May 2016. I've done several breast reconstructions using silicone implants, doing the breast reductions, doing the breast lift. So it's into their hundreds in terms of the numbers you have been able to do successfully.
It's unfortunate that some stories we get to hear of, I don't really think it's breast reconstruction, but it's the cosmetic bit of it, whereby you want your breasts to be enlarged or reduced, or you want them to look a certain way. Some of the cases we've gotten to hear, and I think the very recent one was just early this year, in January, that was trending, where a woman had gone in for this kind of surgery, and unfortunately she got these complications and eventually died, you know. So maybe just to caution, you know, someone who's looking to have the aesthetic bit of it, you know, on what exactly to look out for before them deciding this is the hospital I'm picking, or this is the surgeon I'm picking. Just the do's and don'ts maybe, and just the tips.
Actually, it's a problem that we are trying to tackle in Kenya, and it happens in the hands of what I call almost medical quacks. The reason I'm saying medical quacks, these individuals or doctors who are not board certified plastic surgeons, and they're actually practicing outside their scope of practice, which has been clearly defined by a regulator, the KBC. So I think the first thing before you undergo any aesthetic or breast reconstruction is to find out, is your surgeon board certified? And the second important thing is consult with that plastic surgeon. You have to consult with the doctor who's going to do the surgery. Don't use proxies or middlemen, where we have a lot of that popping up in our country, where someone organizes for you a surgery, but then you don't get to see the plastic surgeon until the day of the surgery. That is totally wrong, because then you're not able to get the benefit of being evaluated, do a risk evaluation, and then discuss how to manage the complications. The third thing that you need to check is the issue of the institution you're going. How many cases of plastic surgery do they do? What is the team? Because not only the plastic surgeon, it's also the post-op care that you receive from there. The nursing team that are in that particular institution, they must be experienced in terms of providing post-operative care. So if you focus on those three things, the board-certified plastic surgeon, the facility being registered to do the plastic surgery procedures, and ensuring that you are actually consulting with the plastic surgeon that is going to do your surgery, then you mitigate your risks in terms of complications happening. So those are the things I can advise the public. If you'll see many advertisements, mostly on Instagram, on TikTok, saying they're able to provide either reconstructive or cosmetic plastic surgery. But what you need to ask, who's the person providing? Are they qualified enough to actually provide that service safely to you?
And to our viewers, remember you can get to call us live. If you've got any questions for our doctor this morning, you can call us. Our number is 0716 103 301. 0716 103 301. You can call in if you have a comment or question. We have the doctor here and he's ready to answer all of our questions. You mentioned for one to, you know, some of the tips that you've just given us right now is you should ensure that whoever is doing this surgery, undertaking the surgery, should be board certified. Is there a way one can be able to check on that? Is there a specific platform where one can log on to and get to find this information?
Actually, because of what has been happening in the recent past, the Kenya Medical Practitioners and Dentists Board has always put a list of board-certified plastic surgeons and also a list of facilities and how they're registered to provide the services. So you can actually, I'll try to look up the number, but there's a code you can send to Kenya Medical Practitioners and Dentists Council, and they're able to confirm to you, to reply to you and say, Dr. Were is a board-certified plastic surgeon, or KTRH is a facility where we have plastic surgeons who provide safe plastic surgery services, and you can actually go there and seek service. So there's actually, the government has provided that avenue through the KMPDC portal.
And also to be able to know how many successful surgeries have been done, you know, in that particular institution. It's possible to check
It's
that
possible
online.
to check because every surgery that is done is a log that you're legally supposed to keep. Together with any complications and stuff. And mostly that you do through societies, professional bodies, where they're able to actually provide with you the list of the members who are plastic surgeons, and also if you want to delve deeper in terms of the statistics in the surgeries being performed here in the country. Yeah.
All right. When a patient comes, you know, say for a reconstructive surgery, or when they're preparing for it, do you also like ensure to prepare them emotionally? Because I can imagine this is someone who has lost their breast, you know, from cancer, or, for example. Do you need to take them through it, you know, emotionally first before getting to undertake it?
Yes. So in KHRH, you have a breast clinic working hand in hand with the plastic surgery unit. And it's a multidisciplinary team. So you'll go there, you'll find their nurses, their counselors. Just the fact that you get a diagnosis that you have a breast lump, that is cancers that need to be removed, needs you to be taken through what that entails and how your life will be after that. So we have a group of actually counselors who do that, working together with the breast clinic unit and the plastic surgery unit at the hospital to ensure that you get all the information you need to make an informed decision on what now you need going forward. Yeah, so we do provide that. Yeah,
it's very needed.
It's very needy, and sometimes they normally also say if you have heard of cases where someone does a plastic surgery case and continues and continues and continues. So there's also that aspect where we work closely with a psychiatrist, where if you look at yourself, you think you're deformed, but when you come to us, then you tell you no, you're perfectly okay. Maybe we can tweak one or two things. So there's a mental health component of that. But then working together with the psychologist and psychiatrist, then you're able to pick that up and then provide for you the care that you need. Yeah.
And speaking about that, yes, we've seen cases, you know, mainly on social media, where someone may seem like they are addicted to these cosmetic surgeries. So they go in for the breast, maybe increase for a breast increase. They have their breast increase. After a while, they still want it to be increased. You know, is this something that you advise?
It depends.
Is it really
so
like
is it an illness, mental illness you're dealing with? And we have a way of checking that. But then maybe it's just you.
It could be a mental illness.
Yeah, if it's not, sometimes as a woman or as a man, you just want to look good. And maybe you've gone out and gotten feedback, maybe from the social media, that you should have done. I saw the other day one of socialites being told that, oh, you should not have done this, remove it back. So it depends on the feedback also you get. But the most important thing is, what do you feel about yourself? Because the decision that you make about you, and then you're able to get the best look that you want. And that's why we're here as plastic surgeons to provide that. Yeah. But then if we pick out, then there's an issue that is more of an illness, what we call body dysmorphism disorder, then you're able also to treat that and ensure that working with a psychiatrist that you get the proper care you need. Yeah.
Just to get to understand better, you know, the reconstruction and the aesthetics bits, the difference. Say you have a patient who's lost one of their breasts due to cancer, so they've come in for a reconstruction. So the reconstruction is you reconstructing the breast, the breast, breast what?
We call it mound.
Mound. The breast mound. And then now the aesthetic bits is for you to ensure that it matches the other breast. Or just take me through that.
So when you have undergone, let's say, mastectomy, you've lost your breast because of cancer, when you come in, we're doing breast reconstruction. It's not aesthetics at all. And you see, if I decide to reconstruct the breast that you lost, then I have to ensure that it looks the same like the opposite breast. So then I'll have to resize that breast so that it looks the same, what you call symmetrization. So that is not aesthetics, that is mainly breast reconstruction. It's a service that actually it's even paid for by insurance and also paid by the social health insurance scheme fund. They also pay for that. So it's something that is considered a reconstructive and not an aesthetic procedure.
Okay. Speaking about the cost, let's get into that. Just how costly is it? And you've clearly already mentioned to us that insurance does cover for the reconstruction, right? So just how expensive or affordable is it?
Yeah, plastic surgery in Kenya is very affordable. In the past, it was
affordable.
Yeah, it's affordable. It was quite high because initially there were 2-3 plastic surgeons. In Nairobi, we boast of more than 30 plastic surgeons now.
Yeah.
So depending if you are paying cash or you're paying through insurance, you find through insurance, because it's a reconstructive, then you're able to afford it because then you've taken an insurance against that particular risk. If you decide to pay cash, it can be as low as 250 to as high as 650,000, depending on what option you're using for reconstruction. Are you using your own body tissues? Do you need to go buy a silicone implant? Are you going to do liposuction so that you can create the breast mount? So we find, and those are package costs. So those cover the hospital stay, they cover the surgeon, the anesthesiologist. So compared to other parts of the world where a simple reconstruction, I was just talking to some of the team we have at KTRH at the moment who are visiting plastic surgeons from Canada. And I was asking, how much does it cost to do a breast reduction in Canada? And they say it's up to 10,000 USD. So if we compared what we're charging here, it's almost a quarter, not even a quarter, a fifth of that cost. Yeah, so plastic surgery in Kenya is affordable, contrary to what people think outside there.
All right, on that note, we take a break. Don't you go too far, we'll be back to continue with this conversation.
Wellness is important in our daily lives so that instead of just surviving, we should be thriving.
Ways to prevent a stroke or heart attack is for you to know what conditions you have by regular checkup. People don't know they have hypertension. People don't know they have diabetes.
I was pre-diabetic. I was afraid of getting lifestyle diseases because I come from a family that has lifestyle diseases.
How do you know if your cough is due to a serious condition? We'll have some answers. Stay well
and strive to make every day a healthy day.
Friday night again.
Greetings in the name of the Most High Jah Rastafari. My good name is Marley Moses, the positive warrior, alongside...
Yes, sir, DJ D-Rage, the baddest. Each and every Wednesday from 10 p.m. on KBC Channel 1 TV.
Tunakuletea the biggest reggae party in 254 in a yard extra. Extra niceness of reggae music.
Extra dose of entertainment.
When the thing is nice,
we have to do it twice.
And we are back. Thank you for staying with us. In case you're just joining us, our conversation is on breast reconstruction and aesthetics. And with me is Dr. Andrew Were, who is a certified plastic, reconstructive and aesthetic surgeon. Now, we were talking about the cost before we took the break. You had touched on, it's not that it's quite affordable,
it's affordable.
You know, though affordable is relative, but if you compare with other countries, just as you did, it's actually more affordable in Kenya. But that is only on the reconstruction bit. You know, the aesthetics bit is not covered by insurance, and it's a bit more expensive, or no?
So the aesthetic bit is a bit pricey, but still within the economies of scale here in our country. It's not covered by insurance. They're mostly exclusions. But then when you come to us in our clinic, we're able to provide for you, if it's in a private clinic, a payment plan where you're able to plan yourself and have. There are banks that are interested now to come on board and support women who want to look different, beautiful, by providing for them those services in terms of advancing, let's say, a credit card that you can use to access the service. But then in terms of affordability, it's cheaper to actually do it here, and it's safer because you'll be taken care of at home than actually flying to other countries where you're a stranger and really don't know whether the person who's doing that surgery on you is qualified or not. Yeah.
Does it leave a scarring?
Scars are something that we have to deal with, but then in a board-certified plastic surgeon's hand, we manage the scars very well so that you don't have unsightly scars. So it becomes more like, for example, if you do a tummy tuck, it's more like a bikini, a very small bikini scar. Then we have devices, we have lasers that we can be able to do, and other energy devices that we can be able to use to actually make the scar fade away. So in scar management, yes, a scar is something that you have to do, especially to deal with, especially Africans. But then, because we scar more, because of genetics, but then...
Oh, Africans scar more?
Scar more compared to, let's say, Europeans or Asians, but then we're able to manage that in a very nice way so that you have something that is sightly.
All right. We've gotten to talk about the risks and potential complications. How about we talk about the pros?
So the pros is, I normally say what most women in our country are not given is the option of having a breast reconstruction. And for the most of them who have come to KTRH, and we have actually attended to them, you can actually see there's a need in terms of them regaining just their confidence as a woman, because a breast is something that is naturally associated with fertility, with womanhood, and we believe that it's something that you should have. So in the past, we used to have you can wear bras, padded bras, or other devices, but now we have evolved as a country where we're able to create and restore that particular organ to you. So I believe that you need to have a breast reconstruction after mastectomy done as a woman. But then, of course, it's a matter of choice. Some ladies choose not to, because because of the trauma of the previous surgery. But now, since we opened this breast reconstruction camp at KTRH, we're seeing more and more women actually coming back. And we have very good testimonials about how it has changed their life. It has helped them integrate back to society. It has made them feel normal. So I think I can just summarize all the pros for that as giving you back your womanhood. And especially, and for men, making men feel more manly, masculine, because no man wants to walk around, let's say, with what you call male boobs. So gynecomastia, then we're also able to excise and reconstruct the male chest for them.
All right, as we almost come to a conclusion, let's talk about the event that is coming up. What is the event all about?
So at KTRH, we normally have breast camps and other surgical and medical camps. So this particular year, we are glad to have faculty and consultant doctors coming all the way from Canada, from Italy, from Ghana, where we're able to exchange ideas and reconstruct breast for women who have undergone mastectomy, and also men who have gynecomastia, and women who have very big breasts that are giving them. So we do this on a yearly basis. So we're from Monday 24th to 27th. On Thursday, we'll be having these surgeries going on at KTRH, and it's actually been paid for by SHA. So I like to encourage women who desire to actually have their breast reconstructed to come actually to KTRH. And even after this week, they can still come to our clinics every Tuesday, where we'll evaluate them and do the reconstruction for them. So I think it's an event that we need. When we exchange with the international faculty, we learn from them, and they're also able to learn from us what we do best and how we handle our patients within the African patients, Kenyan patients. And that exchange of knowledge is very good in terms of making us more skilled and more better in basically what we do. Yeah.
Is it covered fully by SHA? When you say it's being covered by SHA, is it
majority of the
covered?
costs is covered by SHA? Yeah, because it's breast reconstruction and it's there, so it's able to be covered. And for those also who have private insurance, KTRH has a list of private insurances that can actually come on board. But then if you combine the insurance, the SHA, and even if you're paying out of pocket, it's not as expensive being a public hospital.
Okay,
yeah.
All right. There's sometimes there's stigma around, you know, breasts, reconstruction and the aesthetics bit. Maybe how do we go about addressing such stigma? Because I'm sure we've seen, you know, mainly on social media, I guess that's where the negativity mainly is on, you know, where they talk about, you know, it's plastic and whatever. So just as we finish, how to address that very quickly.
So how to address that is through public education, like what we're trying to do.
Okay.
But I believe as a man or as a woman, if you want to change any part of your body that will make you feel good and build your mental health status to be better, improve your quality of life, then you should be able to do that.
All right.
Nairobi, or many more people. You just need to be keen and look around and you'll see the number of women and men who are actually doing these procedures, and they're doing it safely under the hands of the board-certified plastic surgeons.
All right.
Yeah.
Thank you so much for joining us.
Thank you for
having me. And thank you
for
shedding light on this very important topic.
Thank you.
All right, this is where we end this conversation. Remember, the race for IEBC chair is on, and the interviews got to commence yesterday and will be ongoing until tomorrow. Tomorrow will be the last day of the interview. We have